my chosen patient is the equivalent of about a 75-year-old man. Lately, it's a cat. Lately, he has not been really taking good care of himself. He's not grooming, so he's not showering. He just looks really disheveled. His appetite's been decreased, and he says his mood's been feeling a little low since he lost his best friend. So, without further ado, Dylan, how are you doing today? How are you feeling? Okay, I understand. You're not feeling so great. You lost your best friend. You guys have been friends for a long time. You were living together. So, alright, you came in to discuss wanting to get on some medication that would help you feeling better. Okay, I think that'd be good. Talk to me about your other symptoms. Okay, so you feel like you haven't been sleeping that well. Okay, that's understandable. So you don't sleep at night, but you sleep too much during the day. Okay. Alright, how's your appetite then? Alright, you feel like it's been decreased lately? Do you think that you've lost weight? Okay, that's understandable. So, yep, according to my records, yep, that agrees. You've lost about 15 pounds over the last, I don't know, two months or so? Okay. Alright, so any other symptoms that you've been experiencing? Just the mood, lack of appetite? Have you been taking care of yourself lately? Taking your other medications? Alright, not so much? Okay. How about showering, brushing your teeth, anything like that? No? You're finding it hard to do those things? Okay, that's understandable. Okay, so I want to start you on a medication called Remeron. It's also called mirtazapine. It's an atypical antidepressant, which means it's not a standard SSRIs or selective serotonin reuptake inhibitor like Prozac. It works a little bit differently. It's a serotonin modulator, actually. So, alright, so things we can expect out of this: you will have an increased appetite, but in this case, I think that's actually kind of what we're going for. Seeing as you're a little bit older, we want to make sure that you don't get in sort of that funk where you don't want to eat anymore, and you just sort of, decline. So it should help with the sleep disturbance and sort of help you re-regulate. We're also going to start you on some melatonin in the evening to see if we can, sort of even that back out and get you back on a normal sleep cycle. Alright, so things that you can expect with starting this medication include a little bit of GI upset and constipation, as well as you might get a bump in energy. And something that we're going to do is in about 1 week, you're going to come back in for a recheck. We're going to weigh you, and we're going to see how you're doing with your progress. So, things I want to warn you about, if at any point, so starting any antidepressant medication is going to give you more energy, but if at any point you start to experience suicidal ideation, I'm going to give you an emergency number to call, or you call the office. But that's also why I want to see you back in a week. Just going to check in, make sure that you're not sort of experiencing thoughts of suicide. That can be a side effect from starting any antidepressant medication, okay? Alright, do you have any questions for me? Alright, because you're on the older side, we're going to start you at a really low dose of the Remeron. We're going to do 7.5 milligrams just once daily. And we're going to see how you're doing in a week and let you sort of acclimate to the dose, and then probably we'll recheck a week later, and then we'll up the dose to 15, and that will probably be your maintenance dose. And again, the reason I want to see you back is to make sure that the medication's working for you, that hopefully you're feeling a little bit better in about 2 weeks. But we'll keep rechecking every week. It could take up to 4 to 6 weeks to see actual improvement, but just sort of checking in the meantime, just to make sure you're not feeling worse. Alright, do you have any questions for me? Okay, great. Alright, well, if you would see the front desk on your way out, they'll make you your recheck appointment.